Notice there's two techniques here, okay? Because this is a big joint, like a lot of motion, right? 135 degrees. So we want to test distraction of the ulna in more of a neutral position here, and then for outer range, not neutral, but an outer range position for extension, because as a treatment, if they're limiting with extension, this is where I'm going to do this. And all of these mobility techniques, you'll perform exactly as a treatment. So this is assessment right now. So remember with assessment, we're grading how much it's moving and also the end feel, and the end feel should always be capsular with all joint mobility, okay? So we're gonna test it to test the extension, and then we're gonna test it up more in the resting position of the elbow, which is here. And that's gonna test not only the resting position, but also closer to flexion, if flexion is an issue, okay? So again, why could flexion be an issue? Well, they could have tricep guarding, they should have a tight posterior capsule, they could have something interarticular problem in the joint. So there's a bunch of issues that can block flexion. Same thing with extension. You can have biceps brachialis guarding in the front. It could be a joint issue. Okay, so I'm gonna start with the flexion one. So I'm here, okay? And I'm just gonna do a half kneel here. All right, if I had a higher table, you know, you could move the high-low up a little bit. But I'm moving the ulna on the humerus. So I'm gonna be, the first thing I'm gonna be is on the ulna like this. And I'm gonna be putting my fingers in. And then I'm gonna wrap around with my hand to reinforce that. So I'm gonna be like this. If you grab the radius side first, you're gonna be mobilizing the radius. You don't wanna do that. And he'll tell you that even though my hand is on the outside part of his arm, which is the radial side, I'm really not I'm not doing any pull there. So contact 1, fingers on the ulna. Contact 2, reinforce your fingers. Contact 3, I'm gonna use my shoulder to support his forearm, and then I'm just gonna kind of do a little scoop technique like this, and that's gonna give me my distraction. Okay. The second way I'm gonna do it is an extension. You might wanna slide around the camera. Okay. Now, I'm not gonna lock them out because we never mobilize in closed pack, and I'm just gonna have them short of full extension. I'm gonna stand on the outside part of the patient. A couple reasons. This is getting a little weird, okay? All right. Here, I can see the patient, but also I'm gonna be using my piezoform right on his ulna like this. So I wanna be on the far side of the joint so I can easily do this. I'm gonna support his wrist this time with my other hand. And the proximal side of the joint is supported on the table, so that's the block. And I'm right there. That's distraction with flexion and distraction mobility testing with extension. If I want to turn any of these into a mobilization, I can just do a grade 1 or grade 2 oscillation, or I can push through for a grade 4. It's the same exact position. All right. Common mistakes with this is to not stand on the correct side, okay? Or with the flexion one, I already talked about the pushing on the radius, make sure it's just ulna. And then the huge one in both examples is if the olecranon's on the table, how do you distract it? You can't, right? It's weight bearing. So great timing. All right, let's practice.